about compensated and decompensated cirrhosis. So in a cirrhotic patient, when do you call patient has decompensated? If patient develop hepatic encephalopathy or varicose bleeding, or patient develop ascites or jaundice, we call the patient has decompensated. It is controversial whether we should include jaundice in the definition of decompensation or not. But since the many published studies and RCTs, they have included jaundice under decompensation and they have defined it under decompensation, we will use jaundice as a decompensating event. Okay. So you already know about this, whether it is what is the definition of decompensation in cirrhosis. But since the publication of CANONIC and PREDICT studies, the new concept of acute decompensation and non-acute decompensation has emerged. So let me write it here. Acute decompensation, abbreviated as AD, and non-acute decompensation. Okay. So what is acute decompensation? Acute decompensation means if patient develop ascites grade 2 or 3, and the time duration that it should develop within 2 weeks. So ascites developing within 2 weeks. Okay. Another is hepatic encephalopathy grade 2 or 3. In patients with previously normal consciousness. In patients with previously normal consciousness. Okay, normal consciousness. Third is GI bleed. Okay, and fourth is any type of bacterial infection. Any type of bacterial infection. So pause it here. What I have written here, any type of bacterial infection defines acute decompensation. So you may be thinking that, oh, I have heard that if bacterial infection occurs, it precipitates acute decompensation. But he has written acute, any bacterial infection in the definition of acute decompensation. So if there is any bacterial infections like UTI and pneumonia in a cirrhotic patient, can I call this patient as acute decompensation of cirrhosis? Yes, according to canonic study, you can call it acute decompensation of cirrhosis. Okay, even any type of bacterial infection in the body. With any type of bacterial infection in the body in a patient with cirrhosis, you can call it acute decompensation. Why they have included this? This is because what they found that even if you treat the bacterial infection with antibiotics, the prognosis of the patient worsens. Okay, that's why they have kept in under definition of acute decompensation. And what is non-acute decompensation? Non-acute decompensation means ascites. Okay, it is slowly developing ascites. Slowly developing. Here I have written here within 2 weeks. Okay, so more than 2 weeks. It takes to develop more than 2 weeks. Another is hepatic encephalopathy. Mild means grade 1, 2 like that. Okay, mild hepatic encephalopathy. And third is progressive jaundice. And obviously it should be non-cholestatic. Okay, non-cholestatic. So slowly progressive jaundice, ascites, okay, and minimal or mild hepatic encephalopathy, they label it as non-acute decompensation. Why they have separated this acute and non-acute decompensation? Because if you see the natural history of cirrhosis, a patient initially develops non-acute decompensation, maybe developing slowly progressive ascites or jaundice, or minimal HE may be there, you might not have noticed, because patient may not have seek the medical attention for these symptoms, and when patients goes into acute decompensation, patient comes to the hospital. So non-acute decompensation comes in the early stages in the natural history of cirrhosis, while acute decompensation comes later in the natural history. And another thing I would like to tell you that acute decompensation falls in between ACLF and a stable decompensated cirrhosis or compensated cirrhosis. So it falls in between compensated cirrhosis or a stable decompensated cirrhosis and ACLF. And another thing is that you can't use child score or mild sodium score for prognosis prognosticating in acute decompensation. You have to use Cliff acute decompensated score, that is called Cliff acute decompensation score, and that score comprises of age, sodium, okay, and creatinine, INR. Okay, that's why you need to know about acute decompensation and non-acute decompensation, because these terminologies are nowadays used in clinical practice.